vaccination has any help in this whole Omicron situation, or the Omicron strain in itself very weak?
Okay, so again, what we have seen in these two scenarios, and that's why we keep on referring to primary healthcare. Primary healthcare is the first point of entry. It's your GP, your nurse. I'm not always sure how it works in other countries. But at that level, the amount of people or the number of people vaccinated versus unvaccinated are more or less the same that get COVID mild disease. However, what we have seen is that the vaccinated people's symptoms are less severe or intense than those not vaccinated.
Right. So India is currently witnessing a steep of COVID cases. Like numbers are going really high. The city I'm talking from, in Kolkata, we have seen in last 8 days the numbers has surpassed. The daily positive case has surpassed the previous 2 waves in just 8 days. So do you think that it's somehow in India, or specifically in Kolkata, the Delta is being replaced by Omicron, and that's why this steep case? And in this scenario, what Indians or we should do?
Yeah, again, remember, that's part of the nature of this virus is it's fast spreading. Okay, so I think it's important to understand that, because once if you understand that it's fast spreading, it's spreading via droplets, and part of it is airborne, then the precautionary measurements lies in the simplicity. So if you wear your mask is not going to protect you from getting it. Your mask is preventing you from spreading when you're speaking. So you will spread less virus. If you stay away from 1.5 meters, even if you can have it a bit more than 1.5 meters, it will make sure that for those droplets that escape your mask also don't affect the other person. And then good ventilation. And this might be a problem, especially in some of the third world countries where there's not good ventilation. There's not air cons or even normal windows. So for us, the best air con is an open window. So the other problem with real air cons is you can't control the quality of the air. And so much better if you can open up windows as much as possible.
And do you think that this spike is because of Omicron rather than Delta? Because this sudden spike we have seen?
Definitely. So what you try to do is because Omicron is fast spreading, you try to keep people with the mask wearing. That's the non-pharmaceutical interventions. Because what are you going to do? How are you going to? You will never get everyone vaccinated. But at least everyone can afford, hopefully, a mask. And those that can't afford, the government must provide. They must, help out there.